So let's talk about the first thing.
Okay.
What do we hope to achieve with this recording?
So I think that we're just trying to get out there what we do here, what all we offer, and just to tell about ourselves.
And you know, for me, I just go where they tell me to go.
Mm-hmm.
Cheers.
Cheers.
So can I credential you?
Of course you can.
Okay, so people have told me that Jackie is like what it is to be a nurse.
Aww, totally flattered by that.
I've been told by that so
Dr.
many times.
Laurence?
It's crazy. So anyway, so you were meant to be an injector, and you've been hanging out with me doing injectables and surgery for getting close to 2 years,
2 years.
I think. And so this is Jackie Bryant.
It absolutely is, and I feel that way.
Who lives in the great state of Mississippi and comes up here the whole week long, and so you're getting a lot of frequent flyer miles.
I am.
Okay, so what about me?
Yeah, well, you're the best. You're a wonderful teacher. I'm very honored to work alongside you because you are such a wonderful teacher and you're so smart. I always feel safe in whatever I'm doing because you have taught me the right way to do things.
Well,
I've been given the best tools ever to give patients a good experience.
I think I was kind of meant to do this because just a whole bunch of things came together. You know, it takes a lot of things to come together for this to happen. And being somebody that is a surgeon, but recognizes that people want to avoid surgery. I've seen terrible things happen after people have surgery. I mean, not in our practice, never terrible, ever in 2 decades.
Right.
But I've seen terrible things happen. Yeah. And so our patients needs to like be comfortable in what they do and avoid surgery. Like I'm all in for that. So anyway, so I just have decided that every surgeon should care just as much about non-surgical things that they do surgical things.
Absolutely, yes.
You know, I think in the world of aesthetics and in medi-spas, everybody sort of is a herd, right? Everybody like natural, which keeps you natural, because that's the biggest fear that our patients have, right? But I think that really, really doubling down on that and having like thousands of pictures over which we don't have a single patient who's ever thought that they haven't kept their uniqueness. I think that's huge.
Yeah.
So it's not that we say it, it's that we do it.
Right.
So we keep our patients special.
Yeah. We also have a physician-led team.
Yes.
We have you here.
And I will tell you this, it's not just about there being a physician. I've become a big believer that in every healthcare system that there is that's really doing real medicine, and aesthetics is real medicine is, right?
Absolutely.
So like you need everybody. Like you need to have doctors, nurse practitioners, MAs, nurses, and without that, you're not as good as you would otherwise be able to be. So with us, the team allows us to do things that other practices don't do, right? Because what's the biggest secret that we know in aesthetics? The manufacturers get these products approved as being safe and effective, but then we have to really make them work. Maybe they didn't get it approved for the right thing. It got approved for the lips, but we realize it works better in the cheeks. Or we realize it's too stiff, it needs to be softer. So every good aesthetic practice anywhere in the country is, if they're doing the right thing, and most of them are doing it, and I think most of our colleagues are good at what they do. We hope that we can even keep up in the game, right? But we're always making the FDA-approved products better by using them in a scientific and a smart way.
Which provides longer lasting.
Yes, that's exactly right.
Which is another
so
one of
the third thing is that all patients, like I don't even understand why people like Botox. Like they got to come in every 3 months for it, but they still love it. Right?
I understand why.
And Xeomin and Dysport and Juju, I mean, they're all like awesome. And it's just because people love that easy win, right? But what's frustrating for us, right, is that they're coming back on that merry-go-round looking exactly what they looked before. And so we want to offer our patients something, whether it's surgical or whether it's non-surgical, something that lasts them for not months, but years, if not a lifetime. And so that's a really cool thing to be able to do. So longer lasting results, we couple with keeping you special and with a team, because without a team, you can't do it.
Absolutely.
And can we give one example on that? Like one of our favorite things we do, and this goes with longer lasting, is drawing people's actual blood, spinning it, getting the growth factors, adding it to the filler, and allowing somebody's skin to look better and their result to last longer. And people resonate with that. They just love the fact, oh, I'm getting me. So only 1 in 10 injectable practices uses those kind of those like tricks and hacks.
Yes.
And there's only 1 in 100 that use it to the level that we do it.
Right.
So this is what makes our practice worth giving it us a thought.
That's right.